The coronavirus pandemic is an unexpected and unwelcome challenge for the world's water utilities. Ensuring access to clean and safe water for hand washing is a central part of the strategy for containing the disease, and yet the disease itself is a major threat to a water utility's ability to maintain that service. I am Samantha Yates of the Global Water Leaders Group, and in this webcast, I will be investigating how some of the members of our Leading Utilities of the World initiative have been responding to the outbreak. OHara is Italy's second largest water service provider, serving 3.6 million people in Bologna and neighbouring regions such as Modena, Imola, Padua, San Marino, and as far to the east as Trieste. Its service area covers some of the worst affected parts of Italy. The utilities head of water, Franco Fagacci, explained the situation to us in an email.
The situation in Italy connected to the coronavirus epidemic is becoming more and more critical day by day. We are continuously engaged in company meetings in order to assume the most appropriate solutions that allow us to perform at least essential services and, at the same time, reduce contagion risks for our workers. The main concern is about possible quarantines of entire groups of workers dedicated to essential services, such as those involved in the remote control management of networks and plants. We also want to ensure an adequate level of network and plant security with regards to third parties and their own personnel, with a level of service delivery that brings the least possible inconvenience to users. The economic impact on these situations on families and companies' budgets will depend on how long the emergency lasts. If it will prolong over months, unfortunately this scenario appears quite probable. We have to worry about a sensible decrease on tariffs income for our services. This could become, of course, a company problem, but also a social problem due to the fact that we deal with essential public services. OHara has worked to reduce the level of risk in the organisation over the years, ensuring that services are resilient in the face of mains breaks and plant outages, and duplicating control and management systems as part of a disaster recovery plan. But the challenge from coronavirus has come from a different direction. The conditions we are facing overcome the scenarios on which we based our previous emergency plans. Usually, every water company works to ensure the service is improving plants and networks. In this case, the most relevant problems concern the work organisation, not the facilities. Of course, I hope that such a problem remains exceptional and will never happen again. However, we are thinking of new ways of working with a different organisation. Firstly, we will work on our workforce management system and to further strengthen our remote control system. Probably, we will change some minimum contractors' obligations in order to strengthen the supply chain for critical materials and services. Remote working could become the standard working modality for a definitely larger number of workers than now.
The Hong Kong Water Supplies Department serves more than 7 million people with drinking water. It was about as well prepared for the outbreak as any utility could be.
Hong Kong has been encountered the SARS problem in 2003. So during that occasion or incident, we have built up some experience. In fact, we have prepared a contingency plan to deal with SARS afterwards. Luckily, it is not being used again, but now come the COVID-19. That is similar. We also encounter the MERS about the other epidemic. We have also contingency plan from the government. That is a good reference. And also we have the influenza, this sort of contingency plan. It's quite common in some cities, and so we are well prepared in that sense to cater, to react, to respond to this sort of incident. And so at the early stage, we have the contingency plan or the business continuity plan in place already. You know, Hong Kong is a very dense place, dense city, and so the chance of being infected is very high, in fact. And so we have follow the advice of our health department they have a series of guidelines, instructions that help us to ensure our staff would not be infected. And say, for example, if the staff is not feeling well, they are advised not to come back to office. They have to have temperature check before going to work. And also when they enter into the office, we have infrared sort of thermometers to check whether they are okay before going back to work. And also we would have others stagger hours. Say, for example, they have to come by public transport. And so, during the peak hours, they will be quite crowded. And so we allow them to work, come office earlier or later, so as to avoid the peak hours of travel. In the MTR, mass transit is very crowded. And also we would have staggered the lunch hours. Even for lunch hour, they can also have different hours to have lunch. And also they can also work on roster.
What would you do differently next time? How will you adapt your resilience planning?
Technology is keep on advancing. So there may be more opportunity for working from home, and also more remote working. That may even help to contain the problem. See, in these days, the word social distancing is the key word. That is to keep a certain distance to avoid being infected or minimize the chance of being infected. And so there would be technologies and that sort of things that could help the business to enhance their ability to deal with this situation. I think in future we will look into more automation and all remote control, more home office capability.
Looking at North America's experience, the situation is escalating rapidly, with almost 4,000 confirmed cases to date. California accounts for around 12% of these cases. We spoke with the General Manager of the Los Angeles Department of Water and Power, Martin Adams, to find out more about their response and advice for the wider utility sector.
For us, we're a very large public utility. We have a lot of our own crews that do the work. We have actually over 10,000 employees, so we're about 10,500 employees right now throughout the LA area. We're fully vertically integrated utility, and so because of that, we have a lot of people who work in close proximity to each other, and with that, also with the large staff, with very international staff. We have staff that travels on vacation, people that go to a number of events, and so the challenge is not so much the workplace in terms of our work or in terms of worry about being infected by the community. The problem is that people go out and live their lives outside of work, and then the question is, what does someone bring back to work with them potentially? Fortunately, the folks that are in the field, actually, managing the water system as well as managing our power system, are probably in some ways less susceptible to an infection at work because not working in so close proximity with so many people.
While employee safety takes the top spot on LA's priority list, the utility has also been considering business continuity from a financial perspective.
So, of course, within utility, just like for a customer, but cash flows is an important factor. We have to be able to collect revenues, pay our employees, and everything else. But within that, we have to be sensitive to what's happening with our customer base. So we have a lot of folks in the travel business in LA. I'm sure certain parts of the world have a lot of folks that are involved in the airline industry, cruise industry. It's not business as usual, not only for us, but also for our relationship with our customers is not business as usual. And we have to take that into account. At the same time, try to function as normally as possible, unless something really goes off the rails. And the board wants to make sure that we have plans in place that we're being sensitive to that.
Across the pond in the UK, the National Risk Register is the mainstay for the response to COVID-19. Anglian Water, which serves more than 6 million people in England's east, also has its own pandemic plan. The Utilities Director of Customer and Wholesale Services, Ian Rule, tells us more.
The top risk, both in terms of probability and likelihood, has been a flu pandemic. So that's driven our own internal risk planning. So planning for a scenario where in excess of 20% of our workforce may not be available. It's kind of been at the heart of our business resilience and business contingency planning for a number of years now, and it has been in this whole perspective of prepare, then respond, then recover. So that preparedness. So what our teams have, we have a business impact matrix with our teams that understand the criticality of roles within those teams. So we look at it from a team perspective. We also look at it from a accommodation perspective. The most critical roles, we say, well, we cannot sustain absences of over 48 hours to greater than a month. By understanding the nature and number of those roles, then enables us to enact contingency planning.
But what does enacting contingency planning really look like? Anglian Water's Group Change and People Director, Susanna Clements, elaborates.
We're actually running an exercise tomorrow where we are going to game a scenario where everybody has to work from home. And that will mean we can resilience test the network, that people get used to the idea, that they raise the issues that they're thinking about, because obviously we can brainstorm what we think is going to happen, but actually it's really helpful to have a lot more feedback. So we're running questionnaires, online questionnaires, before we do the exercise and after the exercise to collect the data, and that will really help us for when we have to do it for real.
The other bit, probably for us, the bit would be interesting to understand is, as potentially schools close, more and more people go into isolation. Does that 20%, which has been the base level of planning, we've gone higher in critical teams. Does that still hold true? I guess that will be potentially the acid test for us, but comes back to that point about needing to make our plans dynamic.
In the early containment phase, communications have also proven to be key.
You can't communicate too much, and you have to be really very clear, not making any assumptions about what people know and the disinformation that's out there. As far as possible, communicate to small groups about what's exactly happening to them rather than big sweeping statements.
This isn't just a utility crisis, it's a national crisis, it's a global crisis, and it's a human crisis as well, isn't it? So it's affecting people in their day-to-day lives. They're worried about their families, their parents, their friends, and just, I think, recognising that and being cognizant of that and empathetic in the way that we respond and dealing with it is really going to be really important, and no doubt we'll learn lessons as we go through.
The first utilities to come out the other side of this crisis are in China. Shanghai Chengdu is the municipal holding company which is responsible for water and wastewater services to more than 23 million people. Head of Research Wang Qiang provided us with an account of how the utility maintained continuity of service and managed the risks of viral contamination from sewage aerosols.
In February, when the coronavirus outbreak was at the most intense stage in China, we took stricter shifts to make each office and plant have only one staff member work at a time. The cleaning staffs disinfected the plants and also the surfaces of equipment several times a day. Besides, we also strengthened the stocking of raw materials such as chemicals. The measures between water and wastewater systems are different. The operators in water treatment plants are still wearing the normal site uniforms, while those who work for wastewater systems are required to wear full protection suits. People get their body temperature tested every time they enter the plants and are asked to wear masks at work. They also take shifts on taking meals to make sure each time only one staff is having lunch in the break room. Because the coronavirus could be transmitted through fecal-oral routes, we paid more attention to the monitoring of fecal coliforms in the effluents in wastewater systems and increased the monitoring frequency. Besides, We have also been working hard to improve our disinfection processes. For plants that applied UV technologies previously, we add chlorination afterwards. For plants that use chlorination for disinfection, we increased the dosage of sodium hypochlorite.
There are now more cases outside mainland China than inside, as the global pandemic accelerates. Extreme measures have been taken nationwide to control the spread. We asked Shanghai Chengdu what the advice is from China to the rest of the world in managing this crisis.
Taking shifts and disinfection are the most essential measures for containing the virus spread in the plants. The tightened monitoring and control of fecal coliforms and residual chlorine is also important during this special period.
The outbreak of COVID-19 has undoubtedly been a challenge for the water utility sector, but it will leave some positive long-term legacy. It will knit teams closer together. It will pave the way for more flexible working at utilities. It will help speed up the uptake of automation and smart digital systems. It will also, we hope, spread the engagement in co-learning activities between utilities. Stay tuned with the Global Water Leaders Group as we continue to promote the best of the international water utility sector. Thanks for joining us.